Well, at first glance, deciding whether to get the PSA screening test for prostate cancer seems pretty straightforward.
It's a simple blood test and it can pick up prostate cancer long before symptoms appear. But studies have failed to find a life-saving benefit of the PSA or prostate-specific antigen test. With more on all this, our doctor on call, Zorba Pastor, joins us from his office in Oregon. Welcome, Zorba.
A pleasure to be here.
So what's the concern, this new concern about men getting the PSA test?
Well, this, first of all, is a biggie. This is a recommendation from the U.S. Preventive Task Force. And basically, it's really the premier government task force that looks at data to try to determine whether or not a test is worthwhile or worthless. Now, to give you a good example of something that they got rid of years ago, it was screening chest x-rays for lung cancer, because we learned that they really don't do any good. They gave this a grade D recommendation, and a grade D recommendation means not only does it not do any good, but it causes potential harm. It's a very, very important recommendation by a very prestigious government agency, and frankly, it shows that scientifically, PSAs are pretty much worthless. These are in patients who have no symptoms, which we think may be related to prostate cancer.
Is the PSA test part of a regular physical for a man, Zorba?
Well, it sort of depends. We've been shying away. Many of us have started to shy away from the PSA because of the tremendous false positive rate. There's some studies that showed up to 40% of the time that the PSA is positive, there's no prostate cancer. And there are other studies that also show that you can have prostate cancer and the PSA will be absolutely normal. So many of us have done something called a discussion with our patients to decide that. But basically now, it's really shown that having surgery, because you have a positive PSA, carries with it problems that outweigh the risks. Good examples of the problems are the pain and discomfort of having the surgery, the psychological issues, erectile dysfunction, and then after the prostate surgery, men can have dribbling and incontinence. And right now, the U.S. Preventive Task Force says it's not worth it, it's not going to do anything. And believe me, this is going to be a political football just like breast cancer.
But what if there is cancer and it goes undetected?
Well, most prostate cancer does not kill people. That's what it is, does not kill guys. Most men die of prostate cancer. They do not die from the cancer, they just happen to have it. So it's not like picking up heart disease early. It's not like picking up a mammogram and picking up breast cancer early. For most men, the little foci of prostate cancer that's even found in biopsy is indolent. It doesn't actually grow. And that's why they reviewed all of the mega studies and found pretty much, even if you have the prostate cancer as a guy, it's not going to do anything. And this is going to make a major change in how we think of prostate cancer in men.
Boy, that's a big deal.
It is a big deal.
You bet. Very big deal. Not a small deal, a big deal. And you'll start to see it in the newspapers. And of course, you saw it on News 3.
You saw it here first. Dr. Zorba Pastor, thank you. Good advice.
A pleasure.
Good to see you, Zorba. Thank you.